Hi, this is Evelyn speaking. Thank you for tuning in to our project proposal podcast. Brittany and I are doing our evidence-based practice project on the topic of childhood obesity. Our evidence-based practice project proposal is titled The Prevalence and Risk Factors of Obesity Among Children. Childhood obesity continues to be a problem not only nationally but globally as well. Worldwide, more than 300 million children between the ages of 5 and 19 are overweight or obese. In the United States, more than 13 million children and adolescents are obese. In 2009, Georgia passed the Student Health and Physical Education Act. This initiative is designed to enhance nutrition and physical activity efforts in public schools. Public schools who address the nutrition and physical activity requirements of this act receive funding. For the year 2015 to 2016, schools in Forsyth County did not submit data on children's weight, BMI measurements, and physical activity levels. Thus, data on the prevalence of childhood obesity in Forsyth County, Georgia is lacking. To address this gap in research, we will conduct a needs assessment in a primary care family practice in Forsyth County.
For this evidence-based project proposal, we are using the evidence-based question of, in children ages 5 to 10 years obtaining health care at Peach Clinic, what is the prevalence of BMI greater than the 95th percentile and corresponding parent-reported risk factors for obesity in a 1-month period? The prevalence of childhood obesity in the United States has increased threefold over the last 30 years, and the sustained prevalence of childhood obesity sparked the interest for this area. Researchers executing this scholarly project have a passion for pediatric care with a special interest in preventative care. Family nurse practitioners are at the forefront of primary care, making them a vital asset in the prevention and treatment of childhood obesity. Furthermore, FNPs have the skills and training to assess, diagnose, and treat children with obesity. More importantly, they also educate the children and their parents on the prevention and management of childhood obesity. Early identification of at-risk children for obesity and overweight is instrumental in the prevention of childhood obesity and the comorbidities associated with it. Understanding the prevalence and risk factors of childhood obesity, the providers at Peach Care Clinic will then be able to formulate an action plan against the childhood obesity. To the extent of our knowledge, this is the first needs assessment that will explore childhood obesity in South Forsyth County. Family nurse practitioners from the community who are committed to the prevention and treatment of childhood obesity could find the outcomes of this scholarly project meaningful to their practice. Lastly, data collected from this needs assessment could serve as groundwork for future studies addressing childhood obesity among a diverse population, such as the one at the Peach Clinic. Obesity in children is defined as having a BMI equal to or greater than the 95th percentile compared to children of the same sex and age. Research reveals behaviors strongly associated with childhood obesity include an unbalanced diet and sedentary lifestyle. Screen time is one of the most common forms of sedentary behavior seen among children and adolescents. Screen time may include watching television, playing video games, using computers, desktop tablets, or smartphones for academic time or non-academic time. Several studies suggest a strong association seen between increased screen time and obesity in children. Literature also indicates dietary practices and physical activity are related to obesity. Some of the factors that have contributed to childhood obesity include a surplus of energy-dense foods, eating at fast food restaurants, and larger portion sizes. Parents also play an instrumental role in shaping their children's nutritional, physical activity, and sedentary behaviors. In a study by Goncows, Bjorn, Viana, and Trost, it was found that parents' increased screen time behaviors are positively associated with their children's screen time practices. A few other studies support the theme that children may copy their parents' eating habits, screen time habits, and exercise practices. Evidence also shows that parents' motivation to make a change is more likely to happen if favorable terms such as at-risk weight or increased BMI were used to discuss their children's weight instead of the terms overweight and obese. Medical experts now encourage healthcare providers to discuss weight and weight-related lifestyle habits with parents and children at least once a year.
Our proposal has been reviewed and approved by the medical director of a family practice in Cumming, Georgia. We will submit our proposal to the University of North Georgia's Institutional Review Board. Human subjects will be protected, participation will be voluntary, no identifiers will be collected, and questionnaires will be collected anonymously and stored in a secured file cabinet. A quantitative descriptive approach and a retrospective design will be utilized to answer our evidence-based practice question. Over the course of 1 month, parents will be asked if they would like to take part in the study. The study will be conducted in a primary care family practice in Forsyth County, Georgia. Parents of children taking part in the study will complete 2 self-report questionnaires. The questionnaires will collect information on family demographics and parent-reported risk factors for obesity. In addition, children's height, weight, and BMI will be collected from the electronic medical records. We will use a convenient sampling technique to recruit children between 5 to 10 years old and their respective parents. We will analyze the data using descriptive statistics. Graphs, tables, or charts may be used as visuals to highlight significant trends or findings. Findings from this needs assessment will be presented to the medical director and all other providers via a roundtable discussion. Additionally, we will share our findings with our peers via a poster presentation. Here's a list of our references. Thank you so much for watching our presentation.